our path in this anti-parasitic medication movement in cancer. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years and in clinical practice for 27 years. So there's been this continued interest on these anti-parasitic medications such as ivermectin, mebendazole, fenbendazole, albendazole in cancer. And we've had these questions about ourselves. And so I thought it was important to share what our path has been. So one of the first anti-parasitic medications that we've explored was artesunate. It's used for the treatment of malaria. It's from wormwood. It's Artemisia is the plant. Artemisinin is the other ingredients for it, and that's an approved or a global drug that was used for treating malaria. There was a case report that was published in 2005 for a type of melanoma called uveal in the eye, where there was metastatic. This patient incorporated artesunate into chemotherapy and had a very long-term survival outcome. So that opened the doorway for us in exploring this anti-malarial medication in cancer. And moving forward, then there was the work was done from a group out of the UK that they were exploring mebendazole cycled with like an antibiotic called doxycycline, and then incorporating the anti-diabetic medication metformin with the cholesterol medication atorvastatin in cancer. And they were discussing some preliminary work in glioblastoma brain cancers, incorporating that with standard of care, that they felt it was maybe doing something more. So as a result of that, our patients, we were curious and guiding them. Patients were incorporating these things from international sources. So we then took those initiatives to we can prescribe these and we can walk that path together with you and take in levels of responsibility, and which in turn that we were trying to ensure that they were more being safely monitored, which assisted also some of the specialists that we worked with, because they're like, okay, we don't know this world, and at least you're there to kind of also to help guide them to ensure that they're safe if there's any further questions. And so then ivermectin kind of popped into the stage around the time of COVID-19. So even though it's an old drug, it was actually not used in cancer or other areas. And so it's since COVID-19 that thrusted ivermectin more into the center stage, and it seems like it's brought the rest of them with it. And so here we are in 2026, where it's the wild, wild west of these anti-parasitic medications in cancer. And so while there's an interest in them personally, there's even other ones, or even non-anti-parasitics that I think have some interest in other cancers and other areas, but this is the area that a lot of people are interested in. And so, we're taking these positions where we're trying our best to monitor them to try to ensure that they're safe. And, there's some that we're also prescribing as well, and taking that legal responsibility to ensure that patients are being safe. So, it's definitely a complex area. I could see why specialists don't want to walk that area, because it's hard. But at the same time, we don't want people to hide from us. Like, we've had patients hide these things from us for years, and we've known them for years. And I'm like, why did you hide this from me? And it's like, Walter, we're scared, I'm scared, I'm dealing with this, advanced cancer, and, I also wanted to protect you. And so, I just didn't want, and so I put that all together, never told you. And I was like, gosh, So anyways, I don't want people to hide from me. And that's something that I learned from the senior oncologist who retired, named Dr. Paul Klimo, and who's a founder of a chemotherapy unit here in Vancouver. And so that was the approach he took, and that's the approach that we're taking.